I was born in a very small town in Louisiana, Alexandria, Louisiana. I had a very humble background because I came from a single parent family. My dad left home when I was about 6 years old, and my mother and grandparents pretty much raised me like a lot of single parent families. I had an older brother who was 5 years older, a sister who was 16 years older, and she was out of the house. But I learned from a young time that hard work will get you a lot of places. There were a lot of people, because a single parent family, that reached out to us and helped us, that helped raise me, that helped me become the man that I've become. And I feel like I owe so many people. So that's why I try to give back as much as I can. I truly believe that we all need to have a servant's heart. The question is, what are you doing to make this world, make this community a better place? Believe it or not, I started my young career off by serving on the board of American Red Cross. And once again, a service organization helping other people at their time of need. I guess it just sort of fit into my life as far as the experience that I received from serving on the Red Cross. The next thing would be serving on our hospital board. Once again, just helping individuals in the community. I was totally surprised when I was told that I'd received this award, because it's, I guess, the way I live my life. I try to do the best that I can for as many people as possible. I don't look for awards. I was just totally shocked when I received it.
Dr. Ashley received the Texas Healthcare Trustees Founders Award. To me, is a no-brainer. He really exemplifies what you want out of all of your board members and your chairs, is really to be a leader and to support the mission of the organization, and really to be a voice of the community and a voice of patients.
I think the biggest project that I'm really excited about being involved in, and pretty much scared me more than anything else, was when the Clinical Operations Board was established. Each hospital had their own board that did all the hiring of all the physicians and everything. And the system decided they'd come up with a clinical operations board that would try to bring consistency as far as the hiring of all the physicians at all the different hospitals. The scariest thing was when they asked me if I'd chair that. So, knowing that we would be responsible for trying to bring consistency in the hiring of all the physicians in the southern region, at least the Houston market of St. Luke's. After years of operation, I think we've done an incredible job. I have some incredible board members that serve on the Clinical Operations Board with me.
Well, professionally, he certainly is a master of leading a board. And you have incredibly intelligent people on that board, community members from all across Texas, and really was able to galvanize them into a common mission and vision for quality of care across our hospitals.
The way Frank deals with the board, his selflessness, he is clearly an executive with a servant's heart. And the way he leads the board, leads the discussions, keeps things moving, he has been an excellent chairman of the board, as good as any that I've ever worked with, and I've worked with several.
I think in the local board that I'm a part of, in the Bryan College Station area, once again, we try to, first of all, make sure that the community understands everything that we're trying to do. We try to keep our finger on the pulse of the community to see what the needs are. And I think that's one thing that all the board members do. Once again, we're connected to all of the hospitals in our community, and we're the ones who try to keep our finger on the pulse of, what are the needs of the community? What are the needs of the patients that come there? What are the needs of the physicians that are employed there? The physicians, the nurses, all the staff members. So it's once again trying to do our best to make sure that we meet the needs of the individuals in the individual communities that we serve.
thanks to Dr. Ashley. In the role that I play, having a board chair partner like him is super important. And you know, we spend time before each board meeting together prepping for that. And I've never seen a board chair do that either. I would just say thanks to him for what he's built. And I think as he goes forward and, you know, eventually is not on the board, that legacy is going to be there, you know, that will ensure that this board continues to function at the level it functions. So just a simple thank you.
My hope is that everyone is afforded the opportunities for health care that I've been privileged to afford. That would be my dream right there. You know, it's so funny. I really never think about legacy. I always think about, you know, someone, you know, being an old Boy Scout, the old saying is you want to leave things better than they were when you got there, when you go to a campground. And I think that's the biggest thing. If people could say, you know, Frank did a pretty good job. You know, he may have not changed the world, but we did a pretty good job under his leadership. And another analogy I use is, you know, when you think about healthcare, it's like an aircraft carrier, and you can't turn an aircraft very quickly. You know, it just turns very slow, and I hope that people be able to say that, you know, I changed it a few degrees to the good during my tenure here.